The main thing you have to think about is if you are having no other risk factors, meaning you don't have a genetic background of colon cancer, you don't have a family history of colon cancer, the screening guidelines currently recommend you to start at age 50.
Right.
And that means a screening colonoscopy.
In my practice, I diagnose and treat patients who have issues with their digestive tract, which includes the stomach, gallbladder, liver, pancreas, and colon. Now, colon cancer is one of the most deadliest forms of cancer, yet it's also one of the most preventable. Here to help sort it all out for us is colorectal surgeon Dr. Amir Damati. Dr. Damati, thank you for taking the time and joining us.
That's my pleasure. Thanks for asking me.
Of course. You know, and so a lot of people, when they talk about colon cancer, they go, doctor, that's an exit only. Don't want anybody to go near there. But what do you say to those people?
You know, what I say to them is vigilance pays off. Even in those areas that you're the most uncomfortable with, you want to check that area out if there is something wrong. Because if there's something wrong there, imagine when you say exit only, imagine when that exit is broken.
Yeah. You can't, and their whole body can break down, and we know it's the third leading cause of cancer death. So clearly things happen. And what is, tell me about the importance of screening in the sense that how we can save lives and how preventable colon cancer is.
Well, colon cancer actually is theoretically 100% preventable. And it's probably the only cancer that is like that in the U.S.
Exactly.
and across the world. Mainly because we have a wonderful screening test for it. And by that I mean screening colonoscopies. There are other screening tools available as well, but the colonoscopy still is considered the gold standard. Absolutely. Mainly because it diagnoses and also treats at the same time. So that is the gold standard. Then there are other tests if you're completely uncomfortable with that. But if you have a screening colonoscopy, the chances are you're not going to get colon cancer.
That's exactly right. And I'm glad you brought that out. And it's something very important he's bringing up is that the gold standard is a colonoscopy. It's literally, you know, 1 day out of your life, if a 20 to 30 minute test, yeah. And most of the time you're sedated so you don't feel anything. And what he means by diagnosis and treatment is that you find these little tiny things called polyps, or the small growths in your colon that you don't feel. A lot of people come to me and say, well, if it's not broken, why do you want to fix it? The problem is that you don't have any symptoms from colon cancer or even polyps. And so until it's often too late, by the time there's blockage, only time you feel any symptoms is when the colon's completely blocked. Imagine a hollow tube, right? When something blocks it, that's when you feel any pressure, bloating, changes in your bowel movements. Otherwise, you don't feel anything. So it can be broken, and you just don't know it, and you can actually fix it. Dr. Damati, we have a question from an online community member. Anthony from Windsor, Ontario wants to know, at what age should you start getting a colonoscopy, and how often?
Okay. It's a very good question. The main thing you have to think about is if you are having no other risk factors, meaning you don't have a genetic background of colon cancer, you don't have a family history of colon cancer, the screening guidelines currently recommend you to start at age 50.
Right.
And that means a screening colonoscopy. Now, if you have risk factors, meaning you have family history of colon cancer, and by that I mean direct family members, mom, dad, sister, brother, have had colon cancer, that may shift it to an earlier age. And mainly if their colon cancer is below 60, then it's 10 years below the age where they were diagnosed. So if your sister has colon cancer at 55, you should start your screening at 45.
Got it, got it. And very importantly, African Americans, you know, that we forget sometimes, yes. At least in this community and many other communities in the U.S., you know, the screening rates for African Americans are lower than other populations. And the fact is that you should start at 45 for African Americans, 45 years of age, actually earlier than other populations because of an increased risk. So 50 for everybody else, as he talked about, if you have a family history, direct, so first degree, mother, father, sister, brother, that type of family history. And if you're African American, age 45. If you have a disease like Crohn's disease or ulcerative colitis called inflammatory bowel disease, that may put you at an increased risk. So inflammatory conditions, when your colon's always inflamed, that can increase the chance of colon cancer as well. So you should talk about this. And I alluded to this before, Dr. Damati, but what are the warning signs? People are wondering, well, I'm not sure this is this has anything to do with colon cancer, what are the warning signs you want to tell our viewers about?
Well, the main signs and symptoms for colon cancer, remember this doesn't happen until it's late. It's
Correct.
until you've had cancer. So you don't want to necessarily see these signs. But the signs are bleeding, rectal bleeding, or seeing blood in your stool. That's probably the number one sign. The second thing is abdominal pain or changes in your bowels. If your bowels suddenly go from once a day to once every 3-4 days and it's becoming pencil thin or thinner, you have to actually consult somebody to make sure there's nothing bad happening. Now, does everybody that have colon cancer? Absolutely not. But again, this goes back to the vigilance we talked about. Don't sit there and just assume it's nothing. Assume it's something and let me prove that it's nothing.
Correct. The value of a negative test is so important. I'm glad you mentioned that. People think, well, it was a waste of my time because you didn't find anything. I disagree so strongly. The value of a negative test is immense because you know now that you don't have a problem. You can wait 10 years and not have to worry about the fact that something is growing. Now, I don't want you to think that all colonoscopies are 100%, that you can still have some false negatives, meaning that there could be something small that could be missed. So if you have, let's say you have a colonoscopy 7 years ago and you're having symptoms now, it doesn't mean that something couldn't develop, but chances are you're not. Dr. Nandi, thank you so much.
Pleasure
Amazing
meeting you.
informational pleasure.
Thank you.
Pleasure's all mine. Thank you. Hi everyone, I'm Dr. Partha Nandi, and if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.